Menopause is a natural stage in every woman's life. It usually begins around the age of 50, but what if it starts 15 or even 20 years earlier? What if thousands of women are reaching menopause not because of biology but because of the healthcare system itself? That is the disturbing question emerging from Bihar. Data from the National Family Health Survey shows that a significant number of women in Bihar are entering menopause in their 30s. Among women aged 30 to 34, the rate of premature menopause is more than 4 times in the national average. More than 12% of women between the age of 35 and 39 have already reached menopause. The reasons being highlighted are deeply concerning. Researchers point to the high number of surgeries in which uterus and sometimes even the ovaries are removed. These procedures are often performed on women complaining of heavy bleeding or painful periods. Critics argue that instead of medication, counseling and follow-up care, surgery is becoming the first option. It suggests that insurance reimbursement may be encouraging surgical procedures over more conservative treatment. Experts describe this as a supply-side moral hazard where system rewards operations rather than long-term medical care. The concern does not end there. The findings suggest that socio-economically disadvantaged women are the worst affected. Questions are being raised about the quality of reproductive health care. Early menopause is not just about fertility, it can increase the risk of heart disease, osteoporosis, memory problems and mental health disorders because of the early loss of estrogen. So the big question we are asking is, why are so many women in Bihar reaching menopause in their 30s? Is this a medical necessity or a healthcare system that is pushing surgery over treatment? Are poor women paying the price for a system that rewards procedures instead of patient care? And most importantly, who is accountable if women are entering menopause decades before they should? On this issue, I am joined by Dr. Shikha Sharma, One Health and veteran nutritionist, Dr. Archana Dhawan Bajaj, gynecologist, medical director, Nurture Clinic, and Dr. Priyamvada Tyagi, endocrinologist, Max Hospital. Thank you all of you for joining me on issue which is very, very serious, very, very important. And the surgeries which these women undergo, they are not even aware of it. Let me start with Dr. Premvada Tyagi. These are poor women. They take it because there is a free insurance. So this hysterectomy-driven menopause, what can it do to women?
Okay, so one thing I would like to highlight here is that when a woman undergoes natural menopause, there are years of hormone fluctuations, and sometimes it can be very troublesome for most patients, but it helps your body gradually adapt. Whereas in case of a surgical menopause, where hysterectomy along with removal of both the ovaries is done, it leads to a sudden cutoff of all the hormone levels. Now, this can lead to all the complications, including bone loss, osteoporosis, heart disease, can lead to early onset of dementia. It can also lead to severe impairment in, quality of life, leading to affection of their work, interpersonal relationship, and sometimes it can lead to great amount of problems, including certain amount of heart diseases, certain amount of cancer. So this needs to be very, very carefully and assessment should be done before performing this surgical procedure. Not everybody is a candidate for this.
Opening comments from Dr. Archana Dhawan. Your opening comments, because this is something which is part of the healthcare system. You know, this is not happening on its own, madam.
Two mentions here in specific. We've got our data from the National Family Health Survey. This is a cross-sectional data collection mode of getting data. So it's definitely establishing that there is a higher incidence of hysterectomy, but the cause and effect is not duly established. So this is a zone or a gray zone, as I may call it, which needs
Can you break it down for my viewers? They are not medical experts, so please break it down for my viewers.
Right. So basically, we do accept and acknowledge that women in Bihar are having menopause faster than other parts of the country, surgical more than physiological or premature ovarian failure per se. But the exact reason, whether it is just an aggressive surgical approach or just a failure of the healthcare system or other measures which need to be audited, is a little difficult to say at this point. So that is point number one. Point number two, as Dr. Priyamvada said very aptly, menopause happening as a transition from a reproductive period to a perimenopausal period to a menopausal period is a lot softer on the female body than a sudden castration. So when you remove the ovaries and the uterus together, it's pretty much amounting to a castration. You're shutting off the hormones straight away, and what you're getting in return is not just a physical, the usual exposure to osteoporosis, heart disease, blah blah. You're also impacting a lot of psychological and emotional aspect of a woman, because she feels a lesser woman. She's sexually not as active. There's vaginal dryness. There's so much happening to her which is making her feel a lesser person. So definitely there is a medical concern here which needs to be addressed. However, the cause and what is the effect of that cause, whether it is just women walking down a healthcare system where the first treatment being offered is a hysterectomy, vis-a-vis a healthcare system where there is inadequate
Are you saying, madam,
counseling.
that this surgery can also have a psychological impact, sort of a behavioral impact on women?
Absolutely, absolutely. It is not just cognitive difficulty, sleep patterns alter. Psychologically, women start feeling that a part of me is missing. And I'm sure Shikha, who's also a college mate, will be able to, understand this more ably, because she deals with women who are, who are vanity stricken as well as health conscious. So she would learn it better than most of us, that the minute you have a menopause early in the day, your first instinct is, am I a lesser woman? And I'm not just giving emotional jargon. I'm telling you what I would experience of a woman who's been castrated in her 40s.
Okay. Your opening comments, Dr. Shikha Sharma, and in context of, as ma'am said, lesser woman, I mean, say, does it have that deep impact, if it offset because of a surgical intervention? And but if someone has it naturally because it is supposed to happen to a woman, is there a difference? What happens in a natural course and what happens when you are in your 30s?
Absolutely. I think, like it's been very, clearly explained by both my, esteemed panelists, that a woman who literally undergoes removal of the reproductive organ and the hormones, she overnight has become a 50-year-old, if you technically see it. Why? Because all the things which happened gradually to a 50-year-old now happen suddenly to her. Firstly, her skin starts aging very fast. Her hair starts changing very fast. Her libido or her reproductive requirement, or not requirement, let's say her needs start changing. She feels like a lesser woman. Her bone osteoporosis starts happening. So overnight, you have removed a very significant portion of a woman's health and her entity, her identity. Now, when it's a 50-year-old lady, she has seen her children grow up. It's happened very gradually. It is part of the growth process, or let's say a natural aging process. It's very gentle on the body. But even then, we get a lot of women who really struggle and suffer, even in their 50s, during menopause. Now, imagine all that is happening to a 35-year-old who either has had this one child and she may want other children, or she's still like in the phase where she's actually supposed to be childbearing. She's supposed to have those years of her life, of her youth. So I think people do not realize that the uterus and the ovaries are not just a piece of flesh. They are part and parcel of an identity of a woman, and therefore this needs a very different kind of understanding than just removing a wart or a mole or something which is more superficial in nature.
Okay. Dr. Priyamada, is it about the fact that there is very little acknowledgement in context of what role which testosterone does for men and the role which estrogen plays for women, and very less knowledge about this absence of estrogen can do to a woman? Is it also because of that, ma'am?
Okay, so herein I think we have to understand two basic things, that the
Okay.
testosterone in men does not decline the same way like estrogen does in women.
How?
So of course there is
Again,
a
please
gradual
decode it for our viewers, please.
Yes.
Okay.
So even with increasing age in men, there is a gradual decline in testosterone level. Now, that does lead to almost the same things. It leads to loss of muscle mass. It leads to change in libido, which is less inclination towards intimacy with your partner. It can also lead to mood fluctuations. But in men, it usually happens towards a later stage, somewhere about 60 to 70 years of age.
Okay.
In women, depending on the genetics, there's a very strong genetic component here. So in women, it usually starts at age of about 40 years, and sometimes it can go on for about 8 to 10 to 12 years. So this entire
Are
long
you
journey
saying, are
of
you saying the process of menopause can last for 10 years?
yes, yes. And so perimenopause by itself leads to hormone fluctuations, can manifest as changes in periods. Most of the women that we see in our OPD, they come with a lot of quality of life symptoms as well. So that remains very important concern here. As doctors, even in our trainings, we are not very focused on the quality of life care that we provide. Over a period of time, we should, and we have gradually moved to that aspect as well. So hormones are important at all age, and a sudden lack of the reproductive hormones can lead to a whole lot of changes in a woman's body. But of course, I want to make this very clear that all the changes that we are talking about happens only when ovaries are also removed along with uterus. Just hysterectomy alone will not lead to all of these changes because ovaries still produce the hormones.
Okay, but the study says that this is hysterectomy driven, which means that ovaries are
Yes.
also being removed. So why isn't there a debate, or why isn't there literature? Why is there any uh, popular engagement on this issue? I mean, this data has come out. I think it should
Yes.
have been in newspapers. People
Yes,
should have been
and
talking about it.
if we talk about NFHS 5 versus NFHS 4, we can see that the rates of hysterectomy have actually gone up. If we talk
Why
about
have they gone up,
2019
madam?
to
Why have they gone up?
yeah, so this is what I think ma'am had already talked about. That when a woman approaches a doctor about some period irregularities, first of all, making an accurate diagnosis is very important. Then some medication could be tried, lifestyle therapy should be tried, and only when a woman is not responding to this, and after clear cut discussion one on one, and not just once, on multiple occasions, should this decision of surgery should be taken.